Jansen from Acupuncture Gold Coast, and just take a couple of minutes of your time and explain to you a little bit about the approach of traditional Japanese acupuncture to the treatment of frequent urination during pregnancy. This is a very common condition, and there is a very logical explanation for this condition according to the paradigms of traditional East Asian medicine. To grow a child in utero requires what we would describe in traditional East Asian medicine as a lot of kidney energy. The foundational structural energy of the body is called upon to provide the energy to grow the baby in utero. This energy that's been called upon is of a finite quantity. So when a woman falls pregnant of a specific constitution, there is great potential for them to experience frequent urination. And as a result of that, also constipation, but we will deal with the frequent urination at the moment. The cooling, calming aspect of what we call the kidney energy is eroded or utilised and diverted to grow the baby. This means that there is an excessive amount of heating energy available in the body. Quite often women pregnant, their temperature will rise. The body has to deal with this relatively excess amount of heating or yang energy. One of the most productive ways for the body to do that, and one of the easiest ways because of the connection between the kidneys and the bladder in the genitourinary system, is to divert the heat into what we call the bladder meridian and the bladder organ. That heat is what causes the body to increase the amount of urination. It is a way of the body ridding itself of heat. The body will expel heat. It can expel through the head, as it has many occasions for me. It can come out through the skin in the form of perspiration, out through our breath in the form of expiration, to some degree out with the feces when we go to the loo, and also through the urine. So this is one of the very key factors and underlying concepts that we hold in traditional Japanese acupuncture that are quite unique. And having this paradigm or this understanding at our disposal allows us then to treat this condition in a very constructive and generative manner. In other words, we're not looking to get rid of the heat per se. We're more looking at building the supply of the cooling energy up so that the baby that's growing in utero is nourished, and the amount of what we call deficient heat or heat as a result of lack of cooling factor, less of that heat being wasted or being pushed out through the body, and the heat is more utilised as a generative energy in the limbs and in the trunk of the body. So often with the frequent urination there's a tiredness that will come with it. Sometimes there can be also some lower back pain, and also the frequency and potency or power of the urination will also hold some degree of explanation as to what's going on. But the good news is, certainly from my perspective, having treated this condition many times in clinic over the last 30 years, is that through traditional acupuncture, using the very gentle techniques that I have developed over the 30 years with the assistance of many teachers and mentors, using this very gentle acupuncture process along with moxibustion, many cases we've been able to resolve this condition without the use of any medication at all, which is a huge priority in pregnancy as a result of the potential side effects of many medications on the baby growing. So it's one of the wonderful features of traditional acupuncture. We're able to effect these changes without imposing any chemical interaction on the body or running any risk of any deleterious side effects for either the mother or the baby. This is Alan from Acupuncture Gold Coast. Thank you very much for taking the time to watch the video. You're welcome to give us a call at any time to have a chat about this condition. Thank you.